Hi, I'm Dr. Duty. I'm a pediatrician with the Pocatello Children's Clinic. I'm originally from North Dakota. I was born and raised there, and when it came time for training, I moved to Salt Lake City where I pursued my pediatric specialty. After spending 3 years there, I moved to Pocatello and have 2 children. We like to spend time outdoors, camping, fishing, hiking. In the wintertime, we like to ski. So here at the Pocatello Children's Clinic, we function almost like an urgent care. We're immediately available to evaluate children whenever they are injured. Some of the common injuries that we see would be things like sprains, strains, fractures or broken bones, even cuts and scrapes and burns, and evaluating head injuries. If a child is too seriously injured that they need more specialized care or it's a more urgent matter, parents are always welcome to call us first to see if an appointment here is appropriate or whether they would need to go straight to the emergency department. Some of the common injuries that we see in children would include falls that result in either a sprain or possibly a broken bone. We also do see a lot of head injuries here at the clinic. And in addition to that, just wounds like a cut or a scrape to the skin and even burns. A couple of the most important things that a parent can do to ensure safety for their child is to make sure that they're always buckled up and restrained appropriately in the car seat. In addition to that, wearing a helmet whenever the child is participating in certain sports or recreational activities where there's a risk for a head injury. It's important to do that. And just in the home itself, you can't prevent every sort of injury to children because just by nature, children are busy and they're active, so it's inevitable that they're going to get hurt and injured. But you can do your best to try to baby-proof your home, making sure that there's baby gates in place and that you prevent them from climbing and crawling on things where they could fall off of and get hurt. So a fracture, which is also commonly called a broken bone, needs to be diagnosed with an X-ray. And here at the Pocatello Children's Clinic, we do have an X-ray machine available in-house so that we can quickly evaluate and treat your child if needed. So with fractures, it's common to have pain and swelling that occurs pretty immediately after the injury happens. If the child is unable to bear weight and walk appropriately after an injury, if there's significant deformity associated with the injury, if the pain is uncontrolled with simple over-the-counter medications such as Tylenol and ibuprofen, then this means that the child needs to be evaluated by their doctor. Toddler's fractures are a specific type of fracture that occur primarily in toddlers from the time that they start walking up until they're about school age. Because toddlers are still clumsy and they're relatively top-heavy, they trip and fall very easily. So even after what seems like a relatively mild type of trip or fall, a toddler fracture can occur. Sometimes the fracture is so mild that you can't even see it on the initial X-ray. When a child gets a toddler fracture, they may present with pain, meaning that they won't want to bear weight or walk. They want to be held and carried around. You usually don't notice any swelling or bruising associated with a toddler fracture. Head injuries are another type of injury that are quite common in children. They can occur just from a simple trip or fall at ground level where they hit their head, or they can be more serious if they fall from a higher height or have any sort of increased acceleration or force associated with the head injury. The common head injuries that result from tripping and falling at ground level usually result in a very mild type of head injury that can be safely monitored at home. However, a more serious head injury, especially if there's a fall from greater than 3 feet or just the mechanism of injury was significant enough to cause a lot of force, then those ones would be best evaluated at the doctor's office. Some things to watch out for. Some red flag symptoms if there's a head injury that results in a loss of consciousness, repeated episodes of vomiting, any confusion that lasts more than just the immediate time afterwards, any neurologic changes if the child doesn't seem to be walking or understanding things correctly. Some other red flags for head injuries would be if the child is excessively sleepy or if they're excessively irritable. Those could be symptoms of a more significant head injury. Any seizure-like activity would also be included there. Concussions are a type of head injury that are commonly seen too. That's a whole separate category of head injuries. In general, you're going to see those with recreational activities and sports, and if there's concerns that a child has had a concussion, it is best to consult with either your athletic trainer or the physician's office. So a goose egg is a common terminology that is used whenever there is visible swelling and bruising that occurs at the site of impact, and the head is a common place for that. In general, goose eggs can be monitored and watched and taken care of at home, a cold compress, some pain medication if the child needs it. If there is an open wound associated with the goose egg that might require stitches, then you would want to give us a call so that we can evaluate it. Or if the head injury was more significant, if they fell from a higher height or there are any of those other red flag symptoms associated with it, then they should get it evaluated. So minor cuts and scrapes can be treated at home. The most important thing to do initially is to clean the wound out very well. You want to make sure that you remove any debris that possibly may have gotten into the wound so that it's clean to begin with. If you can see any gaping of the wound, or if the deep tissues of the skin are exposed, or possibly if the wound is located in a cosmetically concerning area such as the face, then you may want to get it evaluated to see if stitches or sutures are appropriate. So a common question that we get after a child has a head injury is it okay for them to go to sleep? In general, if your child doesn't have any of the other red flag symptoms, and it's the typical time that your child would be going to sleep anyway, such as nap time or it's time for bed at night, as long as the child was acting normally before they're ready for bedtime, then it should be okay for your child to go to sleep. However, if you are concerned that your child's head injury was significant enough, you can never go wrong with having them evaluated by their doctor first. So if your child has an injury and you can make them more comfortable by splinting or wrapping the affected part of the body, then that's okay to do at home as long as you're able to keep them comfortable and the pain isn't out of control, and as long as they are able to use that affected part of the body effectively. However, sometimes it's a more serious injury, and in the case of fractures, splinting and casting is sometimes needed. Here at the Pocatello Children's Clinic, where we do have our x-ray available in-house, if it is determined that your child has a fracture, we are able to provide the splinting and casting for your child. Sometimes though, if the injury is a little bit more serious or if it requires some specialty care, we could also refer you to the appropriate place for that. If your child has a cut or a scrape that's deep enough that it may require stitches, you're welcome to call us and bring them here to the Pocatello Children's Clinic. However, sometimes if the wound is too complex or if the child needs to be sedated in order to adequately or safely place those stitches, then we may have to refer you to the emergency department for that. Sunburns, the number one thing is always prevention. You want to apply sunscreen liberally. At least an SPF 30 to 50 is adequate with broad coverage for UVA and UVB rays. And you want to reapply it every 2 hours at a minimum, and more frequently if there's playing in the or swimming in the water or excessive sweating. If a sunburn does occur, it can be managed at home, usually, by placing a cool washcloth or towel over the affected area, some aloe vera gel, or another non-irritating moisturizing cream can be used, and pain control with Tylenol and ibuprofen. Sometimes a sunburn can result in blistering of the skin. Usually though, the blistering is not deep enough to cause any problems, but if it does look concerning to you at all, or if there are any signs of infection, then they can get it evaluated here. Kids also often get burned from touching something hot accidentally. This can be anywhere from just a red area of the skin to an actual blister or deeper. Minor burns can be watched at home. You want to run the burn under cool water and clean it, and then place antibiotic ointment and a clean bandage over it, and pain control with Tylenol and ibuprofen may be needed. For more significant burns that have a deep burn to the skin, that have a large blister, or that cover a large proportion of the surface area of the body, then those ones would be best evaluated at the doctor's office. the blisters that are associated with burns can sometimes become quite large and need to be evaluated at the doctor's office. And there's always the potential for a secondary infection occurring at the burn site. So fever, redness, swelling, pus drainage, excessive pain, those can all be signs of an infection and should be evaluated. If you have any concerns about your child, whether it be injuries or anything else, we do invite you to call us here at the Pocatello Children's Clinic. We are available with our regular office hours that you can find on our website or by calling our office at 208-232-1443. In addition to our regular office hours, we also have a doctor available 24/7. So whenever the clinic is closed, you can call our regular clinic line and talk to the doctor on call for those more urgent questions and needs.